All right, Jeff, I'm gonna go ahead and get started. We would just want to welcome everyone who can join us today and those who are going to be listening in after this live session. Thank you for taking a few minutes. We're going to try and keep this, real specific to some of the high points of CCA as a product and some of the other matters going on in the industry, what we're seeing, what we're hearing, and just going to kind of chat about that with our guest this morning, Jeff Hunter. Jeff, thanks for joining us.
Yeah, it's a pleasure to be here, Jason. Thank you for the opportunity.
Absolutely. So again, we want to keep this fairly short so that everyone could, get some of the meat of the information, and then we'll move into a little Q&A with Jeff just to get some of his industry insight. So again, Jeff, with that, I'm going to turn it over to you and let you tell all of our audience a bit about CCA and the reasons why agents should be selling this product going forward.
Awesome. Thank you very much for that intro, Jason. I appreciate it. So for those of you who don't know me, my name is Jeff Hunter. I am Senior Director of Sales with CCA Health of Michigan. A little history about CCA Health of Michigan. We are a new brand. This is our first AEP. For those of you who used to work with or know the name Reliance Medicare Advantage in the Detroit area, CCA Health bought Reliance Medicare Advantage plan, and we are now CCA Health of Michigan. So everything you'll see, whether it's from Medicare.gov to TV commercials in Detroit, social media, whatnot, is all going to be in this red and white branded CCA Health of Michigan. So I've got a lot of slides here today, but I'm really going to focus in on what I call the meat and potatoes of what you guys really want to see and what you care about, and that's where can you sell with us, meaning our county footprint within Michigan. I'm going to talk a little bit and share specifically around network, because that's very important, obviously, and then go through some of the plans and our plan offerings. So with having said that, I'm going to get going here and roll through some of these slides. Real quick, just taking a look at who is CCA, Commonwealth Care Alliance. Where did we come from? How did we pop into Michigan out of the blue and buy this Reliance Medicare Advantage plan? We're a Boston-based company, so we are in Massachusetts, we're in Rhode Island, we're also in California, and now we're in Michigan. So the company is growing and we're on the move across the country. I'm going to skip through some of these slides and speed things up a little bit. This just shows some of our growth and financial strength over the years. But you can see back in 2018, we had 29,000 members. And now in 2022, we've got 67,000 plus members. And you can see our workforce is growing as well. On the far right, we've gone from 1,200 employees to now we're over 2,000 employees. Health plan service area. So like I talked about on the intro, the main thing is to understand where are we, right? We're not a Blue Cross of Michigan. We're not a Priority Health where we're in, 108 counties. We're in 7. So we're starting small. It's a 7-county footprint, Lapeer, St. Clair, Genesee, Oakland, Macomb, Wayne, and Monroe. The only thing I do want to call out here is in Monroe, we do not have a D-SNP product. It's only MAPD. So that's the 7-county footprint. I want to talk about network a little bit, right? Because in the Medicare Advantage space, network is critical to an enrollment. You can have the best benefits and best plan out there in the state of Michigan, but if you don't have network, if you don't have docs and specialists, you're pretty much dead in the water with that plan. So I know this is a busy map right here, but it breaks down the counties: Oakland, Genesee, Wayne, Lapeer, St. Clair, Macomb. And you can see we pretty much have all the big name hospital partners or network partners that you would need in these counties. And the biggest one is that pink box on the upper right hand side. We just added Beaumont effective 10/1. The Beaumont system is now a partner with us. So you can see we've got Ascension, McLaren, Henry Ford, Tennant. DMC is obviously a big one in Detroit Metro. And then on the lower left-hand corner, we're in the process of adding Hurley as well for Genesee County. So I think this map is pretty solid and pretty strong. So this should give you comfort that CCA Health of Michigan has some really strong hospital partners and some really strong network contracts. So service plan areas, again, these are the counties by the different plans. And again, with us, it's pretty, you'll see as we continue to roll through this presentation, it's pretty clean and simple because we're only in 7 counties and we have 3 plans. So I'm not going to be talking about 19 plans today. I'm going to be talking about 3. 2 of the 3 are Medicare Advantage prescription drug plans. That's the first 2. We call them the Excel and Ultima. You can see we have a 0 premium plan, and then we have a $40 premium plan. And then the third column is our maximum product, we call it, and that's our D-SNP. That's a 0 premium plan. So now I'm going to jump into products, right? I've talked about network. I've talked about the counties and footprint, where are we at geographically. These slides here, I'm going to go through our individual slides on each product, but I just want to focus on the bottom big number here down on red. And then I'm going to go through a grid which covers all three plans. I think it's a little bit easier for me to speak to, and it's also a lot easier for you guys to see as well. And if you have cameras on your phones or an iPad, feel free to take a picture of these slides as well. But for the Excel plan, again, this is our zero premium MAPD plan. You've got $6,575 a year in extras that come with this plan. Those extras come in the form of our healthy savings card, which is like our flex card. That comes in, terms of $3,500 a year in dental, $10 copays for insulin, pop-up Pals Care, flex cards for eyewear and eye exams and hearing aids and so forth. Then we pop into the Ultima MAPD plan. And again, this plan also has $6,575 a year of extras as well. This is our zero premium plan. And again, it's got everything on the left-hand side there, all the traditional things that you would see in an MAPD plan. But then there's some add-on things that are nice. For example, the consumer gets a $25 gift card for taking their annual wellness visit. Again, there's that $3,500 in dental and some other good things there as well. And I'll get into that a little bit more detail on the next comprehensive slide. The maximum, which is our DSNP, our dual special needs plan. I can tell you this plan is really bumped up big time. I mean, when you look at the competitors in the market in those 7 counties, I don't think you're going to find another plan that has this number associated with it. The member is going to get literally $8,925 in extras with this DSNP plan. $2,400 a year they're going to get for food and OTC. Again, they got that big number there, $3,500 for dental, rides, vision, hearing, flex card again, and I'm going to talk about some more features here when we get into the grid. As far as medical benefits on the 3 plans, this is what we look like here when we lay out side by side the zero premium or the $40 premium MAPD plans. You can see there's no referrals required. The zero premium plan has a $30 specialist copay. The $40, the Ultima premium, has a $0 specialist copay. I think that's a good fit for your clients, your prospects that may go to specialists, 2, 3, 4 times a month. That would be a really good plan for them. For a $40 premium, for a $0 specialist copay, you're going to save them money. They're going to come way out ahead. The other thing that $40 plan also has that doesn't reflect here on this slide is physical therapy and occupational therapy visits are also at $0. So if you think about that, if you have prospects, which I know there's a ton of them out there that are using occupational and physical therapy along with specialists, this might be a great plan for them because they're going to have a $0 copay for those. Hospital stays, you can see there, $295 per day, days 1 through 6, and then the $290 on the Ultima plan. Our prescription drug plan is very strong on all plans, and I have a different slide as well that goes into prescription drugs, but you can see a $0 deductible and $0 cost share for tiers 1 and tiers 2. Now the last column, the maxima, again, that's our DSNP. And you can see looking down from top to bottom, that's zeros all the way down. So that's a really strong plan. Max out of pocket on the first 2 plans, and closing out the slide is $4,500 each for the Medicare Advantage plans. Here's our pharmacy benefits. These are really strong. Again, reading from left to right, our 2 Medicare Advantage plans. Again, these plans have $0 deductibles. Tiers 1 and tiers 2, $0 copays. And then you can see tier 3 has a $47 copay, tier 4, $100, and so forth. The DSNP, the third column, all the way on the right-hand side, again, it's zeros all the way down. Our national network preferred pharmacy is CVS. So in those 7 counties, I know there's a lot of CVS stores. That's our preferred national pharmacy, if you will. But we also have 26 preferred local, small, geographical, let's say mom and pop pharmacies in those 7 counties. Ancillary benefits. I know this is a busy slide right here, but this is really, again, if you have an iPhone or an iPad, this is a great slide to take a picture of. This really lays out the 3 plans side by side. And again, the first 2 plans are our Medicare Advantage plans. We talked about the OTC. Those 2 plans, they get $200 per quarter. Those 2 plans do not cover food. Vision hardware allowance is $250 on each one of those plans. They get a MasterCard. You'll see in another slide there. We do not have a vision network. It's an open network. They can go wherever they want to get those benefits. So there is no vision network. These plans have Silver Fit. They come with a gym membership, like most Medicare Advantage plans do. They have hearing aids, $2,000, 2 per per year. These plans come with 60 hours of the Papa Pals care, so that's a nice feature. Transportation on these two plans, I do want to call this out and explain what this is, but they get one round trip post-hospitalization ride to their primary care or to their behavioral health professional. Meals, they get 14 meals over the course of 7 days after discharge from a hospital stay. And then scooting down to the annual wellness, they get a $25 gift card. The first plan, which is the Excel, acupuncture chiropractor is not covered. It's only what's covered by Medicare. But the Ultima plan, the $40 plan, you can see there, they do get 20 combined visits, whether they want to use it for acupuncture, massage therapy, or chiropractic care. And then they both of these plans do get the reduced cost insulin, which is $10 for 30 days. The last plan, which is column 3, again, is that maximum. That's our dual special needs plan. And that number, the very first number up top, that's the OTC, and that includes food. So that's $600 per quarter or $2,400 per year that the member can use either for OTC or food. This plan comes with a $300 MasterCard for vision. Again, they get that gym membership, they get the hearing aids, 60 hours of the Papa Pals feature service, if you will. This plan comes with 50 one-way trips. So that's pretty good, 50 rides. And again, you see they get the 14 meals over 7 days. Sneaker allowance, this is truly a unique one. There's not another carrier out there that offers $100 for shoes. So your member is going to get $100 per year in order to go out and buy shoes. And I do have a list. It's literally like 3,000 different stores across the state of Michigan, anywhere from Foot Locker to Champs to the Detroit Tigers Stadium. They can pretty much go just about anywhere and get $100 to purchase shoes. And that $100, by the way, is loaded on their Flex card. The next feature on that Flex card is $50 per month for utilities. The members can use that $50 towards their monthly electric bill, it could be their monthly cable bill, could be their monthly heat bill. We all know our heat, propane and gas charges are going to go up through the roof this winter. So there's $50 to help them out with that. They can even use it towards their cell phone bill. So, and then again, we've got the annual wellness for $25. And this plan also has chiropractic coverage, $0 cost for 20 combined. Again, whether it's acupuncture, massage therapy, and whatnot on that D-SNP plan. So that's a really solid plan. So that's your grid looking at all 3 different plans that we offer. I'm going to roll through some of this stuff. I talked about the sneakers. I talked about utilities right here for $50. I want to just go to dental real quick. Again, so this is the best slide to talk about dental because dental is huge on Medicare Advantage plans. Our dental partner is Delta Dental of Michigan. They're a very, very good dental provider. And you can see all 3 of our plans have $3,500 annually of dental benefits. That's a big number. Again, the first plan this time is the D-SNP. That's the maximum plan. You can see that it zeros all the way down. And by the way, that does include dentures and implants on that dual special needs plan for that $3,500. Then the next 2 plans over again are the Medicare Advantage prescription drug plans, the Excel and the Ultima. Those both have $3,500 as well, but you want to look down at comprehensive. There is some cost share there that you want to be aware of for your members. There's fillings, extractions, root canals. You can see the 50% and 75% co-share costs. And under major restoration, again, this is where you want to have those discussions when you're doing your fact finding with your prospects around dental. What are their needs? If dental is key for them and crowns, for example, is something that's a make or break decision for them, then we may not be the plan for them. So I just wanted to spell that out there in full transparency. This is a busy slide, but this real quick shows you our Flex card. This is what the debit card is they're going to get in the mail. It's going to be a Visa card, just like the picture shows on the right. And it's preloaded with all the dollar amounts for OTC, for food, for sneakers, for utilities, for vision. And then on the bottom, you can see it shows how they access all those benefits. And it's pretty simple, right? They just use it like a debit card. They just simply swipe when they're at the store. And the bottom, reading from left to right, is example of some of the stores. It's not all the stores, but again, CVS, Walmart, Walgreens, Rite Aid, Kroger grocery stores, just a ton of them. When you get into the sneakers there, that's just 1,100 locations. There's even more if you look at West Michigan and Northern Michigan. They can be anywhere. DSW, Famous Footwear, Eddie Bauer. I mean, it's just an endless supply of stores to get those shoes. Utilities, again, anything from Xfinity to Consumers Energy, Great Lakes Energy, Michigan Power Company, you name it. And Vision, again, is anywhere that takes a Visa card. There is no Vision network. They could be at Costco, Target, Myers, wherever they're going to, Walmart, Sam's Club. So that card, I think, is pretty wide open and is going to be a really good value for our members. Again, this slide just speaks to this healthy savings card. If somebody doesn't want to use the debit card for whatever reason, and they want to shop from home, they can do that as well. They can do it over the phone. And they can go online and make their purchases and just use the debit card, just like, we do for any other purchase, or they can go in store. I'm not going to go into healthy savings items. I think you guys should all be familiar with what's covered, what's not covered. But I want to hit this last item here. This is nice because on that Flex card that I just talked about and showed all those benefits, the consumers, our members, can download this app. They can put it on their phone or they can use the website on their computers. But it's nice because it's going to track their spend. It will allow them to see how much they spent on OTC versus how much they've spent on food. So it'll show them how much they have left over for the month towards that $600 spend. I mean, some folks may want to spend all $600, for food, and this will allow them to track that to see where they're at. So this is I think is a really cool app that's new for this year. And then again, vision coverage. Again, it's wide open. This is just an example of some of the stores they can go to, but they can pretty much go wherever they want to. Hearing aids. The last thing I'm going to talk about is hearing aids. Nations Hearing is our hearing aid vendor, and they're very good. Basically, what these slides are saying is the consumer can go online. They can call the 800 number for hearing. They can go to a physical location if they want to get their hearing aids and get tested. With the technology nowadays, it's pretty cool. They can do the hearing aid test right over their phone, which is pretty awesome. It just talks about routine hearing and how they can get access to it. So nationshearing.com is where they'd want to go to, but Nation Hearing offers a wide variety of options in order to get their hearing test and also get their hearing aids. Mom's Meals. I'll hit this real quick. You guys should be familiar with what Mom's Meals are, but again, Mom's Meals for post-hospital discharge. Farm Box, if somebody wants just medically tailored meals sent to their home. Fresh fruits and vegetables, we partner with them as well, which is a great vendor. In closing, we do offer Equifax. This comes free to every member that's enrolled, so they're going to get security features for tracking their credit rating and so forth, and then Silver Fit benefits. So I think I'm going to close there, Jason. I think I've nailed it in about 20 some minutes. But that's a really good overview, I hope, for all the brokers on the call to understand more about CCA Health of Michigan. And I'm going to pop this slide up here. If anybody wants to get my contact information, you can feel free to call me, email me, whatever. I'm accessible to you to help you with anything that I went over today.
All right. Hey, thanks, Jeff. We appreciate that. Obviously, a lot of great benefits built into your guys' products. I think, the challenge all of us have is we're so, we're fed this information, these details from so many different carriers, whether it be one state, multiple states, that it gets difficult. But I think it's very clear to see you guys have an extremely healthy benefits package. If you were to say, because I know you guys as a carrier research, the other carriers, other products out there in the market, if you were to take all of those and just summarize into maybe a few key benefits where you guys are kind of the standalone, nobody else is doing that, or you guys far exceed the standard, where would you tell agents to pull your product out?
Yeah, great question, and thank you for that. Yeah, I would. It's funny you asked that because I was just spent a lot of time in Medicare.gov studying and analyzing the plans. If you look at like Oakland County, for example, there's 74 different zero premium plans. Boy, that's a tough one to differentiate in that county alone, right? I would go back to, again, that when you're doing the fact finder and drill down on those consumers who are using the physical therapy, going to specialists a lot, using occupational therapy a lot. I think our MAPD plan, especially the $40 one, would be a really, really good fit for a consumer there, because I know physical therapy visits, specialist visits at $35 or $40 a pop with some of our competitors can really add up to a pretty significant monthly bill. So in terms of MAPD, I think that's where we win. Dual, I think we win pretty much across the board. I mean, when it comes to numbers mathematically, again, that $2,400 per year for food and OTC is a huge number, and I think that's a big win for the consumer. I think $3,500 $100 for dental is also a big win. Again, that covers dentures and implants. And then just some of the unique characteristics there around $100 for shoes, $50 for utilities. I think we're going to win there. It's really, getting that CCA Health of Michigan brand out there versus the other brands that Michiganders are comfortable and have seen for years. I think that's going to be probably one of the bigger challenges. But again, we're trying to help you guys by doing a lot of marketing in those 7 counties, whether it's TV commercials, social media, billboards, and things like that. So, but I think our D-SNP is definitely one that if you're in that space, it's definitely a product that you should consider selling, and I think should be an easy sell to the consumer.
Yeah, no, I would agree. You guys really built out a nice, healthy package across all products, but definitely that D-SNP I see far exceeds much of what we see out there. Now you kind of touched on it, so a good transition. That was going to be a question. I hear from some agents, some of the agents have stated, some of their prospects have said, hey, who's CCA? I don't know CCA. What are you guys as a company doing about that, since you're a newer brand to the Michigan space this year?
Yeah, so we're doing a lot of things as far as literally TV commercials. We've got radio spots running. We're doing a lot of social media. We just fired up a Facebook campaign that started last week. So we're looking at any senior publications, we're running ads. But the main thing is, so we're getting the red out there, the CCA Health of Michigan red. We've got 2 company vehicles we just purchased, and I just got them all wrapped last week. So those are going to be out and about in the Detroit market, driving around, working at events and so forth. We are out at events a lot with CCA employees and staff to try to get, the level of comfort face-to-face out in the community as well. And then I think a differentiator for us is just our model of care is unique, that we have on staff clinicians who are actually out meeting with the consumers in their homes doing health risk assessments. So I think that's also going to create some buzz for us.
All right, awesome. No, great stride and efforts there to get your guys' name out into the community. And I know we're starting to see it. I know, as you've mentioned, you guys are out there generating some interest. We've had some nice lead generation come from that. We've been handing those out to the independent agents. So, again, nice opportunity for the agents. All right, well, great. To wrap up, anything else you would recommend to agents? Any other tidbits, suggestions, helpful tips that you can provide to agents? What you're hearing is working out there, that kind of stuff within the agent community.
Not really anything specific to CCA Health. I would just say this is an overall, tidbit that, again, when you look at the amount of competition that's out there, I think for the agents on this call here today, when you're out marketing and you're out meeting with prospects and clients, don't forget, I think whether it's CCA Health of Michigan or Blue Cross or Priority Health, the carrier comes second. They're buying from you first. You're your own brand. So really make sure you drill down on, your standard operating procedure, building rapport, showing empathy, asking the right questions, taking your time to do everything you need to do, because the consumer buys from you first, the carrier is second. If they don't trust you, if they don't see you as a knowledgeable advisor, they're not going to trust you with their healthcare, right? They may, allow you to take an enrollment with you if you're in their kitchen because they're uncomfortable to say no to you. But if they're not comfortable with you in the long run, that app's probably not going to stick. They're going to enroll with somebody else. So just remember, you're your own brand. What you do really matters, and the work that you do is very important. So that would be my closing tidbit.
All right, no, that's great. And to add to that too, we are seeing that this is becoming really more of a year-round type process for agents, whether it be marketing, prospecting, sales. So, again, becoming more sophisticated with your Medicare marketing strategy, your sales process, knowing that it is year round. Us, the carriers, we're all preparing for more of a 12-month instead of just a, AEP, especially as we see products compete, benefits getting better, stronger, less movement across plans. So again, making sure you're out there and visible in the community 12 months a year is really key. Again, I think that did a great job covering the high points of CCA and giving some nice, tidbits to the agents here, Jeff. I appreciate you joining us to do that. Appreciate the agents who are listening in, whether it's live or in future recorded versions of this. If you have any interest, please reach out to Insurance Advisors Direct. We'd be happy as an FMO for CCA to get you appointed, contracted, certified, ready to sell. Of course, here's Jeff's contact information if you have more questions for him. So again, thank you for your time, Jeff. Appreciate all of you joining us. And I think we'll conclude there.
Thank you again, Jason. My pleasure. Appreciate it.
All right. Have a great AEP, everyone. Bye now.